Hello and welcome back to another episode of Criminal Justice Corner. I am your host, Dr. Jennifer Matthews. Here at Criminal Justice Corner, we give you the real details surrounding the case. And just in case you find yourself in the same situation, we give you potential actionable advice so that you can find your way out of it. So today I have with me a very special guest, Dr. Kiki. Dr. Kiki is in the plastic surgery world, so she is here to bring her expertise to the show. Awesome. So the non-surgical procedures that you perform are such as?
So the medical procedure, we do a lot of the injectables, Botox, we do fillers, we do the fat dissolving treatments, the non-invasive body contouring treatments, so lipo dissolve, we do cavitation, radio frequency, things like that. So most of our services are non-invasive or minimally invasive. So we are using needles, but we're not cutting and sucking things out. And we also do the hydration and the wellness portion of it too.
Oh, I love that. Now, if someone wanted to contact you or come to your spa, how could they locate you?
Definitely. So as I mentioned, we're in Orland Park, Illinois. So you can contact us by phone, 708-966-4258. We do have a website, www.skyrose, R as in Robert, C as in Charlie, S as in Sam.org. And then we are on Instagram and Facebook at Skyrose RCS as well.
That is so wonderful. Thank you for that information. And I want to dive into this very peculiar case today about Dr. Ben Brown out of Gulf Breeze, Florida. He did something that, to me, I was so shocked by it that I thought it was really good for us to cover here on Criminal Justice Corner. And I thought you would be the perfect person to provide insight about the case because Dr. Ben Brown was performing surgery on his wife, Hillary Brown, back in November of 2023. And Hillary ended up dying from the different procedures that her husband was performing on her. So there were so many procedures that he was performing on her. I mean, is that normal to perform multiple procedures at one time? I know about the mommy makeovers. I know that's a lot of procedures at once. But is it normal to perform the extensive surgeries that she was getting performed? Is that normal to perform all at one time?
I wouldn't say normal. It's so many people that, and this is why you see a lot of the women go out of the states to get certain procedures done. And that's because outside the states, they do something that's called aggressive. So I would say what he did kind of falls on the line of being of an aggressive approach, because when you're trying to do all those procedures at one time, you're trying to knock out whatever it is that client needs or wants within a short period of time, but it's not always great for the body. Speaking of liposuction itself, there's only so much fat safely that can be removed with liposuction. And so a lot of the plastic surgeons that practice safely here, they stick to that rim, but some women want that whole snatch 360 right away. So then they're flying to the DR, they're flying to the Mexico, they're flying out and getting it done outside the country because they will take out more than what is legally or safely supposed to be done. Because when you're snatching so much out of the body has to adjust to that change. And sometimes you're knocking yourself out of equilibrium and the body's not catching up because all your electrolytes are off. And that's when you start going into all those arrhythmias because your electrolytes are off. You are carrying, 20 pounds of fat and someone just snatches it out in 2 seconds. Your body has to adjust to that. And so a lot of people end up having those complications after those procedures because they're taken out or they're doing too much that the body does not have enough time to adjust to. So looking at what he did, that was a lot. It was a lot to be doing. Yeah, it was like minimum things, but you're talking about a repair, an abdominal repair. You're talking about another type of repair. You're talking about liposuction itself. And now the lip fillers was minimum, but it was like she still was under for those other procedures with anesthesia and other pain medications to kind of get her through it. Not everybody. And then you have to have a certain body weight, like I'm not interested in doing the surgery. have a best friend who's in CRNA school, and it's based on your weight, how much anesthesia they can give you. And she looked like she was a very small woman.
Right.
So, she took a bunch of other stuff.
She did.
And he gave her stuff. So who knows, and then on top of that, all of the procedure that the stress the body's going under. So that was a lot. I would say is definitely overkill.
So specifically, she was getting on this particular day, miniature muscle placation, hopefully I'm saying that right, abdominal scar revision, bilateral arm liposuction, lip injections, and ear adjustment procedures. All of this on the same day when she went into cardiac arrest. And, which is very ironic to me, Hillary, the one, his wife, she prepared her own IV bags. And she ingested a handful of multicolored pills, which included Valium before the procedure. And she did not, it says, have formal medical training to do all of this stuff.
Which that in itself is negligence. You're the medical provider in this facility, wife or not. There's no reason that she should have been preparing her own IV bag. And what did she put in it? Do you even know what she put in it? Because you're getting ready to give her something, right? You're getting ready to give her something to relax her.
Yes.
So they say she mixed something in there. What was it? Do you know? Has
exactly.
that been revealed?
And how much, like you said.
How much did she put in there? And then she took a handful of pills that included Valium on top of you giving her additional anesthesia. That was
right. And he gave her the anesthesia. She then took Valium and a concoction of other drugs. What was that all about?
Right. And then,
and he didn't record it in the medical records. He didn't record any of this in the medical records.
We as medical professionals have an oath to do no harm. And the fact that you allowed her to do all of that with no medical background, allegedly.
All of that harm. Look, all of that harm.
All of that harm shows the negligence that you have and the respect that you have for this field in your own license. Because, I have family members. I do a lot of, I'm not going to let them come into my practice and set up shop for their Botox treatment. I'm not going to let them pre-numb themselves with, go ahead, go get that bag ready. Go ahead, put your vitamins in there. That's my license. I'm the medical professional.
Absolutely.
So if anything goes,
That's right.
You're allegedly being charged with this because something went terribly wrong and you were the one that was in charge.
Absolutely. Right. And then what further, we just gonna keep taking this story further. What further blows my mind is Benjamin allowed his wife, with all of these surgeries being administered, he allowed her to suture her own skin after the initial scar revision surgery. Dr. Kiki, how is that possible? How is that possible?
I don't know if he was high himself because none of this makes any sense. Was she a medical
assistant? What are we talking about here?
Some sort of surgical assistant that had the skills and ability that you observed her? Like, what was the sanitation when she was doing it?
Was he short-staffed that day? What is going on?
Because then they say it was a medical assistant there that he asked that asked him what to do after the situation or something. When I had read on it, it was I think a staff member, but that the freedom that this woman had in his practice is scary. It's scary on so many levels, because if that's what you're allowing her to do because she's your wife, and as a medical professional that is licensed and you're a plastic surgeon, the repercussions behind anything that we do that's considered to be negligence. What sense do you have for your patients? Like, how are you operating with your patients?
Right. And then it further goes on to say, because we're going down this whole day, it further goes on to say, as Benjamin began the second procedure of her liposuction on her arm, Hillary became restless and her feet began twitching. And Hillary told him that her vision was getting blurred and that she saw orange. Dr. Kiki, is she awake during this procedure? What is going on here?
Sounds like he probably just gave her some sort of anesthesia to just numb her.
Numbing?
Just more of a numbing. But the fact that she's having this twitching, she's feeling, they said she's feeling how?
She was they saying that she restless. And her feet began twitching. So restless.
Visual disturbances, all of those are signs of some form of some type of toxicity. She didn't took Valium, a handful of other pills, and top of that, her IV that who knows what was in the IV, and then whatever you gave her on top of that. And so at that moment,
right. So then
you should stop to reassess her and see exactly what's going on versus continuing the procedure.
And get this, he does not do that. Instead, he proceeds to the next surgery, which was lip injections. And they're saying that at that point, Hillary was showing obvious signs of lidocaine toxicity. That's what they're saying. Because they did an extensive investigation. So he did not stop with the procedures. He just took a short break, and then he proceeded to the next injection surgery, and it was lidocaine toxicity, which is what she was suffering from. And then on top of that, he injected.
No, go ahead.
I'm sorry. Oh no, I was listening to you. Go ahead.
Use lidocaine to numb for the lips too. So she probably had a bunch of lidocaine throughout these procedures. It sounds like.
Exactly. And then lip injections, like she was already experiencing the lidocaine toxicity. He continued on, he injected more lidocaine, and that's when she became unresponsive and had a seizure on the table. So she's on the operating table having a seizure. Wouldn't this be the time, Dr. Kiki, to call 911?
Yes. In any medical setting, particularly one as controlled, supposedly controlled as an operating room, the proper response to emergencies is crucial. So at this point, if you don't know how to manage it, which you should have some basic knowledge of how to manage a seizure, at least to keep the patient safe while they're having a seizure, you need to be calling someone, which is 911, to assist you. If someone is experiencing any type of medical crisis, the immediate response will always be to seek emergency assistance. So that should have been 911 if you didn't have the proper protocol or even the bodies to help you in this situation, then to just not do anything or continue to get these procedures done on her.
So he did have a medical assistant, which was a really good thing. And the medical assistant immediately said, hey, should we call 911? You see she's seizing. And Dr. Benjamin Brown said, hey, no, wait. And this went on for 10 to 20 minutes of him just allowing this to go on, her seizing and being unresponsive. He did not seek out immediate medical attention for her. Why would a licensed medical professional do that?
It's sad because as a medical assistant, a lot of them feel like they don't have a voice when they're working with a doctor or someone that's in a higher position than them because, it's their job. They don't want to seem like they are being disobedient in a sense or going against what their boss is telling them. But although you don't have a state license, a medical license, you're still in the healthcare field. And I started as a medical assistant, and we're taught, how to handle certain situations. And so you see in this moment that this person is pretty much not good. You have, even if it's not, whatever medical expertise, it's just common sense judgment to call 911 because you can help them. Regardless of this person telling you, no, this lady is possibly dying in front of you. You can get a job somewhere else. For one, I wouldn't even want to work for somebody who don't want me to call 911 on his wife that's pretty much about to die in his arms. Like that, I would basically myself on, is this somebody that I want to work for that in a case of an emergency, he's not willing to go above and beyond to save or help someone. And this is his wife. So what would you think he would do if it was you that needed that assistance? So no one really knows that person's thought process in that moment. But a lot of the times they do feel like they don't have a voice. And it's like, well, he told me not to, so that's why I did it. But sometimes we just got to step outside of that and do what's right. And what was right is calling the 911.
Absolutely.
Because everything she was dealing with
immediately.
Every second counts. And had they probably got there, who knows? We don't know. She might still be here, because it seems like, what was the oxygen deprivation to the brain, in a sense, her being got down with the cardiac arrest. So it's, sometimes we have to go against the grain and do what we know is right and not what someone think we should do because, I don't want to get fired because you'll be able to find another job. It's probably something better, but this person's life is at stake in that moment.
Right. So after the approximately 10, 20 minutes, then they called the ambulance and she was rushed to the hospital. And when she finally got rushed to the hospital, she was put into a coma. And a week later, she passed away. And the cause was complications following lidocaine toxicity. Do you think this could have been avoided, Dr. Kiki?
Oh, definitely. Definitely. For one, she shouldn't have been doing her own IV bag. Two, they technically, before any surgery, they tell you not to take any other medications. At midnight, you're NPO. The only medications I think they will allow is like if you are on like blood pressure pills, but pain medications, like you shouldn't be taking any other prescription pain medications prior to a major surgery that they're going to be providing anesthetic to you for, especially anesthesia. So that should have been avoided. Like she should have been treated like a regular patient and been giving proper instructions on what to do prior to the procedure, which leads me to wonder, how often has she done this? This couldn't be the first time. Okay. For her to be that comfortable.
Right.
Mixing her own bag. For her to be that comfortable to just be in there doing that, how many other times have she done it? Or he allowed her.
That's right. That is so true. Yes. So now, of course, he is. Right. So now they're charging him, as I would think they should, charging him with, let's see, they are charging him with the death of his wife. So do you think he's culpable? That's the next question.
I mean, I believe they should. I believe they should. Can you hear me?
Mm-hmm.
Yeah, I believe they should. I mean,
yes, I can.
He showed from the beginning to the end, lack of respect for life. Like you're allowing her to come in and do all of this. You're not double checking to make sure what she took. And then it was like they didn't know what she took. And then you're blaming others instead of taking responsibility. And then you mentioned he didn't even document his own steps. So it's like you're just in there, like anyone that me, friends, family, it's a whole chart on what I did and what you got.
Right.
Even if it was a simple B12 shot, I need you to sign that consent. And then we can get you the B12. Like, it's still our license, it's still our practice. This is our livelihood. And the last thing you want is for someone to say you did something to them and they got harm from it and you have no documentation. None whatsoever.
Exactly.
And then you refuse to call 911. That's crazy.
Mm-hmm. Yeah. So they're specifically charging him with second-degree felony homicide, manslaughter by culpable negligence. I think those are appropriate.
I agree. I agree. Because
now
he had a duty and not uphold it at all.
Now we know too that he has other cases, like malpractice cases, out against him. So not only was his wife acting in a way that she should not have been, but this is not the first time that he has disregarded his medical policies and procedures. What do you think about that?
It's a pattern. It's a pattern. And he had no, he obviously, everything that he is allegedly getting behind this, it seemed like it's warranted. Because, you went to school to get where you are. And some people allow their egos to get the best of them. and feel like they're above the law and they're above the rules and the regulations. And eventually it bites you. It comes back to bite you. It's like, you're not above anything else. We all have rules and regulations and compliances that we have to stand by, as we serve our community and our clients and our patients. We have a right to make sure that patient safety is priority, family or not.
Absolutely.
I mean, you have to look now. It's like,
yeah, and that's what,
behind being the reason that your wife is not here for her kids, and now you're in jail, so they have no parents.
Exactly. Now, what I always like to do is give the audience some takeaways. This case is so extreme, and it just so happened to be a husband and a wife. But we know that plastic surgeries happen all the time. They happen everywhere in different states and different countries. If a person is wanting to get plastic surgery, they don't know which way to go, which way to turn, what would be the best steps for them to take to find a good licensed professional?
Do your research. And that's what any professional, honestly, not just plastics, primary care doctors, cardiologists, anything, but do your research. Don't be in a rush because this person is popular on Instagram. Everyone's going to them. Everyone's flying to them. Do your research. Ask questions, right? Interview the doctor. You're spending your money with them, but you're also putting your life in their hands. So what is their success rate? Ask those questions. What are their, what are the complication rates? How many cases have they had where patients went through XYZ? But do the research on that person and do extensive research, background, if you have the time. So much stuff is available to the public in regards to, like, if these doctors have any type of suits against them. Don't ignore it. If you see that this person had a malpractice, like you say, he had 2 other cases open, and now look what didn't happen.
Right.
If people are poured more about their experiences, and that's the other thing, look at testimony. Really don't go off of the testimony that they send you of someone. Like, it should be a page, maybe some people will just go on a site and they'll kind of see people that were serviced by them and reach out to them in their inbox, like, hey, what was your real take on this person? But in so many words, just do your research, do your due diligence. If your gut is telling you don't do it, don't do it. You have to listen to your intuition because it's there for a reason. So if you're not 100% sold on this person that is going to be putting you under, if the environment doesn't look safe, if the staff doesn't look safe, you may want to just keep looking, because this is your life at the end of the day, and we only get one.
I could not have said it better. I think that is so awesome. I think that is so awesome. That is the best thing to do. Do your research. Now, before we leave, I want to give you another chance to let our audience know how they can reach you, because that's super important.
Definitely. So again, we are Sky Rose Rejuvenation Clinic and Spa on Instagram, on Facebook, as well as YouTube. It is at Sky Rose RCS. Our location is Orland Park, 9505 West 142nd Street in Orland Park. We're inside of a salon lofts. Phone number 708-966-4258. Or you can always visit our website at www.skyrosercs.org and get most of your questions answered there before reaching out to us.
Awesome. If you enjoyed this episode of Criminal Justice Corner, I'm sure you'll love similar content in the Alive Podcast Network app. Plus, you can support this podcast and enjoy ad-free listening to nearly 100 other Black-hosted podcasts. So, Dr. Kiki, I want to thank you so much for being my special guest today. And I want to thank everyone for listening. If you have not already done so, please like, subscribe, and share Criminal Justice Corner podcast with your friends and your family. And we will see you next time on the next episode of Criminal Justice Corner. Thank you.
Thank you for having me.